Let's discuss the Chinese and Western medical thought, the diseases in Western medical thought. The history of Western medicine in ancient times was similar to that of Chinese medicine, but took a very different route in modern times. Knowledge would come from challenging accepted truths of the past and progress from scientific revolutions that challenge and replace all theories and the path-breaking discoveries following the advent of scientific medicine in 19th century Europe. Western medicine in distant antiquity evolved from spiritual belief but underwent a transformation similar to that brought to Chinese medicine by the Beijing. After the Hippocrates corpus, diseases previously thought to be linked to spirits and gods were regarded as disorders caused either by external environmental factors or internal disruptions in the body. The nature of man in Hippocratic writings, for example, states, when a large number of people all catch the same disease at the same time, the cause must be ascribed to something common to all and which they all use. In other words, to what they all breathe. However, when many different diseases appear at the same time, it is plain that the regimen, that is diet and exercise, is responsible in individual cases. This insight led to the distinction in modern medicine between diseases caused by infections and environmental factors and illnesses caused by factors internal to the body. An influential medical sect, the Methodists, introduced a new medical theory that dominated the Roman world for some 3 centuries from the Mission to the time of the Emperor Marcus Aurelius. The Hippocratic medicine had earlier tied together the part affected by disease and the theological theory to explain the disease, thereby allowing the physician to ascertain indications for therapy based on the locus of the disease. The Methodists rejected this epistemological approach, and this insisted that good medicine was simply effective therapeutic practice and it was not necessary to search for the hidden cause of disease. Thus, Methodists spoke of affections rather than disease and did not concern themselves with theology, convinced as they were that a good doctor should never concern himself with the causes of disease. The Methodists emphasized notion of repletion, indicating excesses in the body, and depletion, indicating deficiencies. These notions were somewhat similar to excess and deficiency syndromes in Chinese medicine. Galen, whose ideas were to dominate Europe up to the end of 16th century, rejected much of the Methodists, but this view of human health was in principle not all that different. Drawing inspiration from Aristotle and the Hippocratic writings, he viewed organized human bodies like bodies in nature as composed of the 4 elements of fire, water, earth, and air, with the 4 qualities of these 4 elements being heat, moisture, dryness, and cold. Disease stem from abundance, scarcity, or change taking place in the humors comprising blood, phlegm, yellow, and black bile. Hence, diseases were classified according to the humor that was in excess or scarce or which suffered a defect in its movement, each of which required a different therapeutic approach. Such notions of excess and deficiency were to persist in Western medical thought, right through to modern times when their importance was eclipsed by notions of disease causation derived from discoveries in microbiology. That such notions continued to be central to Chinese medical thought is worthy of note. It is as if the dazzling discoveries of microbiology diverted Western medical science to cells and genes and held it on nosological track, neglecting the perspective of the body as a whole in relation to its internal and external environments. Chinese medicine, on the other hand, knew no microbiology and had little choice but to look at the body's external manifestations as a whole. Ancient and pre-modern medicine in Europe focused on understanding the conditions of human bodies in the grip of disease, the progression of these conditions, the pathogenesis, and appropriate therapies of healing. Less emphasis was placed on epistemological issues of causation. What made the patient fall ill in the first place? Before the 19th century, theological discussions of disease in Europe revolved largely around moral and social factors such as drunkenness, intemperance, gluttony, and dissipation. Parsley, for example, attributed diabetes to indulgence in excessive amount of cold fluid, poor living, sleeping at night in the open air in state of intoxication, sudden halting of perspiration, and mental anxiety. Thank you for your attention.
Let's discuss interviewing still on energy levels. To be completely correct, neither blood deficiency nor yin deficiency directly result in tiredness. This is because there are more physical substances that nourish but do not activate the body. Most books state that tiredness is a symptom of both blood deficiency and yin deficiency. Fatigue arises in these conditions because blood and yin nourish the organs that produce qi, and because yin is the fundamental substance that is transformed into yang. Furthermore, the brain is nourished by blood. This means that whilst too much mental activity depletes blood, a lack of blood will also result in a person feeling mentally tired and exhausted. Both blood deficiency and yin deficiency fatigue can be exacerbated when the person has difficulty falling asleep or sleeps poorly at night, which is a typical consequence of yin deficiency and blood deficiency. The difference between blood deficiency fatigue and qi deficiency fatigue will be seen in the accompanying symptoms and signs, such as dry skin, poor vision, scanty menstrual bleeding, and so on when there is blood deficiency. A person with yin deficiency fatigue will not always be conscious of their tiredness. This is because they are often restless. Their fatigue can be exacerbated when they do not go to bed at the proper time and when they sleep poorly. They will often feel tired during the day, but in the evening, when yin should control yang, their yang starts to ascend because it is not anchored, resulting in their shen becoming more active. This means that they feel more awake and start to become more active. This is unfortunate because by being active in the evening and at night, they will further consume their yin, worsening the condition. The inability to anchor their shen also means that they have difficulty in sleeping. This just exacerbates their fatigue the next day. People with yin deficiency can sometimes find that their fatigue feels worse or arises after they have started to receive acupuncture. This is because acupuncture controls the restless empty energy that they have, and they then begin to become aware of their underlying fatigue. This is not dissimilar to small children who are overtired in the evening. The later it gets, the more restless and agitated they become. They do not feel tired but are in fact exhausted. A person with qi stagnation fatigue will often feel tired in the morning and when they are physically inactive. They do not feel tired later in the day or when they have been physically active. This is the reason that many people with liver qi stagnation play a lot of sport or exercise physically. Training excessively can in fact be a diagnostic sign of liver qi stagnation. It can be a form of self-medication. A person with liver qi stagnation will often experience fatigue when faced with a task or situations that they have an aversion to. They will also feel tired during stressful periods. A person with liver qi stagnation will not just be tired in the morning, but often will also be grumpy and bad-tempered because their liver qi is stagnated. This is a significant difference from a person with a dump phlegm stagnation who will be mentally absent and hazy in the morning. Heart qi stagnation can also cause tiredness, but it will be more on the mental emotional level. They will lack joy and vitality, and they will often feel depressed. Dampness or phlegm stagnation fatigue. People with phlegm or dampness will often feel tired and lethargic in the morning. Dampness and phlegm will accumulate around the body when it is not transformed and transported. When the person lies horizontally at night, yin substances such as phlegm dampness will seep down to the head, blurring the brain. Furthermore, the lack of physical movement in the body will also add to the stagnation of dampness and phlegm at night. A person with phlegm dampness will also have an increased desire to sleep. They will have trouble waking up in the morning and feel heavy and tired, both mentally and physically. They will have difficulty being mentally present at the start of the day because their shen is blocked. A person with phlegm must be careful not to sleep too much during the day. Sleeping will not usually ameliorate their fatigue and lethargy, but will usually make it worse. Humid weather and low pressure can cause a person with phlegm dampness to feel more tired. This is because the external dampness will aggravate the inner condition of dampness and thereby block the circulation of qi in the body. To summarize, fatigue that is worse after activity or increases during the day means qi deficiency, yang deficiency, blood deficiency. Fatigue that is worst in the daytime but gets better in the evening is yin deficiency. Fatigue that is worst in the morning and the person is irritable in the morning is caused by liver qi stagnation. Fatigue is worse in the morning and the person is mentally lethargic and not present in the morning is caused by dampness or phlegm. Fatigue that is worse after exertion is due to deficiency conditions. Fatigue that is better with activity is caused by stagnation conditions. Feeling tired and lethargic when not physically active is liver qi stagnation. Fatigue that is worse or occurs after sex signifies kidney deficiency conditions. Fatigue when there is low pressure or high atmospheric humidity is dampness and phlegm. Fatigue arising when frustrated or faced with challenges is liver qi stagnation. Fatigue after meals, especially after eating rich food, is spleen qi deficiency. Thank you for your attention.
Let's talk about intertransformation of yin and yang as we continue the 4 principles of yin and yang. Although opposite, yin and yang can change into one another. This transformation does not take place at random, but is determined by the stage of development and by internal conditions. First of all, the change takes place when conditions are ripe at a certain point in time. Day cannot turn into night at any time, but only when it has reached its point of exhaustion. The second condition of change is determined by the internal qualities of any given thing or phenomenon. Wood can turn into coal, but a stone cannot. The process of transformation of yin and yang into each other can be observed in many natural phenomena, such as in the alternation of day and night, the seasons, and climate. The principle of intertransformation of yin and yang has many applications in clinical practice. An understanding of this transformation is important for the prevention of disease. If we are aware of how a thing can turn into its opposite, then we can prevent this and achieve a balance, which is the essence of Chinese medicine. For example, excessive work, which is yang, and without rest can induce extreme deficiency, which is yin, of the body's energies. Excessive jogging, which is yang, induces a very slow pulse, which is yin. Excessive consumption of alcohol creates a pleasant euphoria, which is yang, which is quickly followed by a hangover, which is yin. Excessive worrying, which is yang, depletes the yin energy of the body. Excessive sexual activity, which is yang, depletes essence, which is yin. Thus, balance in our life, in diet, exercise, work, emotional life, and sexual life is the essence of prevention in Chinese medicine. And an understanding of how yang can turn into yin and vice versa can help us to avoid the rapid swings from one to the other, which are detrimental to our physical and emotional life. Nothing would be more difficult to achieve in our modern societies, which seem to be geared to producing the maximum swing from one extreme to the other. The transformation of yin and yang can also be observed in the pathological changes seen in clinical practice. For example, exterior cold can invade the body, and after a time, it can easily change into heat. An excess condition can easily turn into a deficiency one. Excessive heat, for instance, can damage the body fluids and lead to deficiency of fluids. A deficiency condition can also turn into an excess one. For example, a deficiency of spleen yang can lead to an excess of dampness or phlegm. It is therefore extremely important to be able to discern the transformation of yin and yang in clinical practice in order to treat the condition properly. Thank you for your attention.
Let's discuss the extraordinary young organs, marrow. The marrow, the common matrix of bone marrow and brain, is produced by the kidney essence, and it fills the brain, spinal cord, and bones, forming bone marrow. The kidney essence is the origin of marrow, but the post-heaven chi also plays a role in the formation of marrow. In fact, the spiritual axis in chapter 36 says the refined essence of food and drink is changed into fat. It enters the bone cavities and fills the brain with marrow. The Chinese concept of marrow should not be confused with bone marrow as defined by Western medicine. In Chinese medicine, the function of marrow is to nourish the brain and spinal cord and to form bone marrow. Thus, it is the common matrix to brain, spinal cord, and bone marrow. So, marrow in Chinese medicine is not the same as bone marrow in Western medicine. It is the common matrix to bone marrow, spinal cord, and brain. So here, the relationship between the kidney essence, marrow, spinal cord, and brain. For the kidney essence, it goes to the marrow, which is the bone marrow, and fills the spinal cord and the brain. Marrow is closely related to the kidneys, as the kidney essence is the origin of marrow. The simple questions in chapter 34 says, if the kidneys are deficient, marrow cannot be abundant. The functions of marrow are, it fills the bones, it contributes to making blood, and it nourishes the brain. Now the marrow fills the bone. The simple questions in chapter 17 says the bones are the residence of marrow. Chapter 10 of the spiritual axis says, in the beginning of life, essence is formed. This in turn forms the brain and marrow. Sang-Ji Bin said the essence is stored in the kidneys. The kidneys communicate with the brain is yin, the marrows fill the bones, and it also pertains to the brain. Therefore, the essence is the origin of both the brain and the marrow. The marrow nourishes the bones. Next is the marrow contributes to the making blood. Although modern Chinese books often says that bone marrow contributes to making blood in their desire to find parallels between Chinese and Western medicine, there are few references to the role of bone marrow in making blood. Nevertheless, there are some. For example, the Book of Medical Transmission of Master Sang says the qi that is not spent returns to the kidneys to make essence. The essence that is not discharged returns to the liver to make blood. Chapter 5 of the simple question says the kidneys generate bone marrow and this generates the liver. As the liver stores blood, it seems legitimate to assume that the ancient Chinese had some understanding of the role of bone marrow in making blood. In any case, in clinical practice, the kidney channel is indeed used to tonify blood. For the clinical note, as the kidney essence is the origin of marrow and bone marrow, the kidney channel can be used to nourish blood. The functions of marrow, it contributes to making blood and it nourishes the brain. Thank you for your attention.
Let's proceed to treatment principles. multiple roots and manifestations. So far, fairly simple examples have been given when only one root gives rise to one manifestation. In reality, however, actual clinical cases are often more complex. There can be more than one root as well as more than one manifestation. There are three possible situations: multiple roots, each giving rise to different manifestations; one root giving rise to different manifestations; the root coincides with the manifestation. It is very common to have more than one root. This is due to the fact that in the course of one's life, several different causes of disease occurring at different times may overlap. For example, a previous trauma to a joint may predispose someone to subsequent invasion of exterior cold and dampness in that joint. Or someone may suffer from a liver disharmony caused by dietary reasons and later on in life develop liver yang rising from repressed anger. Thus, there can be different roots, each reflected in various different manifestations. For example, a patient may have liver fire, the root, caused by certain emotional problems over a long period of time. Later on, he or she may be exposed to cold, invading the channels of the shoulder and causing pain and stiffness. In this case, there are two separate roots, one being liver fire caused by emotional problems, the other being exterior cold invading the shoulder channels caused by exposure to exterior cold. It would be wrong then, in this case, to try and interpret all the clinical manifestations in the light of one root only, such as liver fire. As for the treatment, when there is more than one root, each one must be treated. There is often an interaction between two separate roots. If a person suffers from liver fire, if he or she suffers an invasion of wind leading to painful obstruction syndrome, the P syndrome, he or she will be more likely to develop damp heat in the joints. Another example, a patient may suffer from Yin-Yang deficiency, the root, caused by excessive sexual activity. Later in life, he also suffers from stagnation of liver qi, another root caused by emotional problems. In this case, there are two separate roots, Yin-Yang deficiency and liver qi stagnation, from two different causes, and it would be wrong to try and weave all the clinical manifestations into a common pattern. The different roots often do not coexist independently, but may also interact with one another, further complicating the picture. For instance, the stagnant liver qi may invade the spleen and cause spleen-yang deficiency, which would further aggravate the kidney-yang deficiency. One root can give rise to several different manifestations. For example, if a patient, particularly a woman, suffers from spleen qi deficiency, this can give rise to edema because spleen qi is unable to transport and transform fluids, and also to deficiency of blood because the spleen is unable to make blood. There will therefore be two manifestations, the edema and the deficiency of blood, arising from the same root. The treatment in this case is still simply directed at treating the root. In certain cases, the root and the manifestation coincide. This can happen only when the clinical manifestations are caused by external physical trauma, such as in an accident. For example, if a person has an accident to the knee, this will cause stagnation of qi and/or blood in the knee channels, leading to pain. In this case, the stagnation of qi, the root, coincides with the knee pain, the manifestation. So, multiple roots would involve multiple roots, each giving rise to different manifestations. One root giving rise to different manifestations. The root coincides with the manifestation. Thank you for your attention.
Let's continue with diagnosis according to Zanko organ patterns. For today, we discuss lung heat. Lung heat can be both an acute and a chronic pattern. Acute patterns will be caused by invasions of exogenous pathogenic qi that have been penetrated into the qi level. Invasions of exogenous pathogenic qi can directly generate heat in the lung. Smoking or exposure to tobacco smoke can also create lung heat. Ingestion of food and beverages that are hot can indirectly create heat in the lung. What are its symptoms and signs? There will be barking cough, dry throat, painful lungs, flaring nostrils, rapid and shallow breathing, shortness of breath, bitter taste, or a metallic taste in the mouth, there will be intense thirst, aversion to heat, red face, red lips, dark and scanty urine, constipation, restlessness, red tongue with yellow coating, rapid and full or rapid and superficial pulse, especially in the right tune position. What are its key symptoms? There will be barking cough, thirst, aversion to heat, red tongue, and a rapid pulse. For its treatment principle, we drain heat from the lung and regulate lung qi. In our acupuncture treatment, you can choose from points lung 1, lung 5, lung 7, lung 10, LI 11, UB 13, DU 12, DU 14, and REN 17. We use the draining needling technique and we can bleed DU 14. For the explanation on the choice of points, lung 1, lung 5, lung 10, and DU 12 and UB 13 regulate lung qi and drain heat from the lung. Lung 7 and REN 17 regulate lung qi. LI 11 and DU 14 drain heat. A person with heat in the lung is advised to avoid eating or drinking anything that has a hot dynamic. Tobacco smoke is hot and drying, so the person should avoid exposure to this. Lung heat can be caused by the following patterns of imbalance: invasion to exogenous pathogenic qi and liver fire. In turn, lung heat can result to phlegm heat in the lung and lung yin deficiency. So to summarize, lung heat has its etiology in interior heat from yin deficiency or qi stagnation from chronic emotional strain, from an invasion of external pathogenic heat. It has an underlying pathology in lung yin deficiency, invasion of lungs by wind heat, and lung qi stagnation. Its signs and symptoms are cough, slight breathlessness, feeling of heat, chest ache, flaring of nostrils, thirst, and a red face. The pulse will be overflowing and rapid, and the tongue will be red with yellow coating. For the treatment, we enrich yin and clear lung heat. In our acupuncture treatment, we can choose lung 5 to clear heat from the lungs, lung 7 to restore lung descending function, lung 1 to descend lung qi and alleviate cough, bladder 13 to supplement lung qi, lung 10 to clear heat from the lungs, and lung LI 11 to clear heat. All with needle this with drainage. Thank you for your attention.
Let's discuss diagnosis according to 8 principles. The heat part 3. For the etiology, excess heat can arise in several ways. Excessive intake of foodstuff, beverages, and spices that have a warm or hot energy. Typical examples of this are chili, garlic, pepper, alcohol, lamb, fried foods such as chips, falafel, crisps, and so on. This will be especially relevant when there is heat in the liver, stomach, and intestine. Prolonged emotional imbalances, stress, frustrations, anger will create heat in the heart and liver. Smoking tobacco creates heat, especially in the lungs. Invasions of exogenous evil qi, heat can directly invade the body. The invasions can be via the exterior or directly into the interior. Invasions of exogenous cold can transform into heat in the interior. Internally generated evil qi, such as dampness, can transform and become damp heat. For the signs and symptoms, there is thirst, aversion to heat, the skin may feel warm when palpated, the face can be red or woody, discharges and exudations that have changed color and become yellowish or greenish, excretions that have become sticky or stickier, excretions that smell or taste strongly, pain that is probing, stinging, or burning, excessive sweating or lack of sweating, constipation, red tongue, rapid pulse. For the key symptoms, there is thirst, aversion to heat, red face, red tongue, and rapid pulse. For the treatment principle, we have to expel or drain heat. The key symptoms, there is thirst, aversion to heat, red face, red tongue, and rapid pulse. For the treatment principle, expel or drain heat. Acupuncture points we use, if there is heat in the exterior, choose from Do14, Do16, Li4, Li11, Sanjiao 5, Lang 11, GB20, and Erjan. If there is heat in the lungs, choose from Lang 1, Lang 5, Lang 10, Do14, Li11, UB13, and Erjan. If there is heat in the heart, choose from Heart 8, Pericardium 5, Pericardium 7, Pericardium 8, Do14, UB14, UB15, Ren15, and Erjan. If there's heat in the liver, choose from liver 2, liver 14, Do14, urinary bladder 18, Erjan. If there is heat in the stomach, choose from stomach 43, stomach 44, stomach 45, Li11, Do14, UB21, Ren 13, and Erjan. If there is heat in the intestine, choose from stomach 25, stomach 37, stomach 39, stomach 44, and Erjan. If there's heat in the urinary bladder, choose from UB28, Ren 3, Do14, and Erjan. If there is blood heat, choose from liver 1, liver 2, spleen 10, Do14, UB17, and Erjan. For the needle technique, draining, bleeding can be applicable. For the relevant advice, a person with excess heat should avoid food and drinks that have a hot dynamic. Typical examples of these are chili, garlic, pepper, alcohol, lamb, fried foods such as chips, falafel, crisps, and so on. They should try to avoid stress. If there is exterior heat, you should recommend they drink mint tea or elderflower. Thank you for your attention.
We continue with depression, still on etiology. Guilt is a common cause of qi stagnation. It affects primarily the heart and kidneys. The heart qi stagnation also affects the ethereal soul and restrains its coming and going, resulting in a lack of ideas, projects, aims, and inspiration, and a general lack of sense of direction in life. As guilt also affects the kidneys, it weakens the willpower, the weakness of which is an important feature of depression. So guilt causes qi stagnation of the heart and kidneys. All emotions lead to some qi stagnation initially, also those that deplete qi, such as sadness and grief. Not all qi stagnation is related to the liver. In emotional problems, other organs suffer from qi stagnation, the lungs and heart. Note that liver qi stagnation may also derive from emotions other than anger. For example, worry and guilt. Constitutional traits play an important role in the etiology of depression. For example, a constitutional deficiency of the kidneys with its resulting weakness of the willpower is a frequent underlying background for the development of depression. A constitutional tendency to heart patterns is also an important contributory factor to the development of depression. The most important and reliable sign of a tendency to emotional problems is a midline heart crack on the tongue, as we can see on this picture. Diet plays a secondary role in the etiology of depression. It contributes to the development of depression in the presence of emotional stress. Excessive consumption of dairy foods, sweet, sugar, and bread may lead to the formation of phlegm. Phlegm may become a contributory pathological element of depression because, first of all, it impairs qi and would therefore aggravate any deficiency and stagnation of qi. It is also obstructive and heavy and therefore would cloud the mind, leading to mental confusion. This condition would aggravate a condition of restraint of the ethereal soul. A dietary contributory factor in the development of depression is a diet lacking in nourishment. This occurs when patients follow strict slimming diets or when they apply a vegetarian diet inappropriately. This leads to deficiency of qi and blood, which are the conditions underlying deficiency types of depression. Overwork, in the sense of working long hours without adequate rest for several years, leads to kidney deficiency, and this often forms the background for depression in older people. So the etiology and pathology would include emotional stress and that would involve anger, sadness and grief, worry and guilt, constitutional traits, irregular diet, and overwork. Thank you so much for your attention.